So today we're going to be talking about a couple of different things right here, and we're going to be talking about Tylenol and does it cause autism. So there's a big announcement made that, hey, you need to avoid Tylenol because it could cause autism, right? So just personally speaking for me, anytime I hear something like that, I'm going to take it serious until I know otherwise, right? I can definitively prove that, yes, Tylenol does not cause autism. Or, yeah, it does? Okay, we're really not going to do it there. Okay, so here's the study. One of the studies that they used to say, hey, you need to be careful about taking autism. And this was a fairly good study. What they did is they took babies that were born and they drew blood from the umbilical cord, right? So the umbilical cord is what the baby uses to get the nutrients from mom and get rid of the waste. Okay, and so one of the things that's really nice about this is not, I think I took Tylenol, not quite sure when. You get rid of all that stuff. And so you have an objective measure of how much Tylenol is in the system. Now, a couple of things that this may or may not have measured. It could have measured, how fast these women gave birth, or could measure some other thing. Anyways, what we found was that the lower the level of Tylenol was in the blood, the lower the risk of autism. So when you had the 996 babies that they studied, when they broke them into the lowest third, so 332 babies with the lowest level of Tylenol, they said that is the baseline level of autism. When they did the average level of Tylenol, they had twice the level of autism compared to the lowest level of Tylenol. When they had the highest level of autism, the Tylenol, they had the highest level of autism. So right here, double the risk of autism, almost 4 times the risk of autism. Okay, so what is wrong with this study? Well, number one, this is observation, right? I'm watching you, but I don't know what exactly is going on with these patients. Were they different before I did anything, or is the Tylenol that did it to them? So a couple of things about this. Overall, about 10% of the population studied had autism. That's 3 times the national rate. So we're already seeing kind of a selection bias here. So looking at a different study in terms of Sweden. So what they did is they measured how many women got a prescription for Tylenol. And so when they looked at women that had prescriptions for Tylenol, that was 7.2% of the population that had those scripts and filled those scripts, they found that there were 15% more likely to have autism. Oh my goodness, it's confirming it. Okay, well, hold on. That's step one. Then what they did was they looked at those women and they said, hey, do they have any children? Do they have any other children? And so they looked at it and said, hey, among them, are those children more likely to have autism? So if let's say mom took Tylenol, is a baby that she took Tylenol for more likely to be autistic than a baby she didn't take Tylenol for? And the answer to that was no. And so we can definitely see there can be a selection bias here. It can be pretty powerful at times. So this effect size, one of the things we're measuring at is, unfortunately, this is a one-shot wonder. This is measuring the Tylenol at birth, right? So what exactly are we measuring here, right? I doubt just taking one pill of Tylenol at birth made your baby up to 4 times more likely to develop autism versus a woman that took the lowest amount of Tylenol here. So probably unlikely, although thalidomide took 1 pill at the one time, 6% chance of baby being born without arms and legs. So it could happen, but unlikely. That this has been going on for years and years and years, nobody's noticed. The other thing is, so more likely than not, the same kind of woman that would take Tylenol at birth would probably take it during her pregnancy. Okay, so that's more believable right there, right? So a couple of things that we could be measuring. Number one, this could be telling us what the effect of Tylenol is. Obviously, that'd be the most concerning, right? So yes, that would definitely be concerning if this is the effect of Tylenol. Number two, it could be measuring women that had faster labors, right? And so this woman, she's coming in with pain. They give her Tylenol. She gives birth. in an hour, the Tylenol is going to be a lot higher than if it took her 7 hours to give birth. The Tylenol is going to be at the lowest level, right? That could be it right there. All right. Number two, option right here, right? Maybe one of the things that this could be measuring is a woman's willingness to take medication overall, right? So if you're in pain and you refuse to even take Tylenol, all right, chances are you're not willing to take any other medication as well. And so probably that's going to lower the risk of any sort of issue going on with the baby. So maybe the Tylenol's okay, but the problem is it's, let's just say hydralazine is the issue. All right. And so maybe that's what we're measuring. All right. And then thirdly, maybe it's something particular to mom right there. So maybe women that are more autistic or carry more autistic genes are more likely to take Tylenol or medications in general during the pregnancy than a woman that doesn't have a lot of autistic genes. So who knows? Given kind of what that Swedish study is looking at, it doesn't look like it's the Tylenol per se that's the issue. It looks like it's maybe these other characteristics. Either mom is taking some other medication, or that maybe for whatever reason mom has genes that make her more likely to have autism, and so her children are more likely to have autism. Last but not least, though, is it's not completely out of the question to say that the Tylenol itself may be the issue. So, for example, we know that Tylenol reduces the glutathione levels in the blood, and that low glutathione can be associated with autism. We also know that getting an infection does reduce levels of glutathione. So, not completely out there, but my vote is probably that this is more tracking something other than the Tylenol use. And so we're a little bit off here in terms of what's going on. All right. Well, I hope that helps. I look forward to seeing you soon.